Hi, welcome to Sultanah Bahiyah Hospital, a lore star to all final year medical students of Asian Institute of Medicine, Science and Technology. We hope you will enjoy your stays here and learn as much. In this short video presentation, we would like to brief all medical students during this 4 weeks clinical surgery attachment. As we all know, we are at the era of COVID-19 pandemic. Please listen to this presentations carefully. Department of Surgery, Sultanah Bahiyah Hospital, is busy tertiary referral center for northern region of Malaysia. We are one of the main department in Sultanah Bahiyah Hospital, and we handle acute and elective surgical services. This department is headed by Mr. Nil Amri. Our department is complex with multiple subunits: general surgery, colorectal, hepatopancreatobiliary, urology, pediatric surgery, surgical ward at Old Alor Star Hospital, plastic and reconstructive surgery and neurosurgery. Because of time constraints, medical students not expected to do rotations of Alor Star Hospital, plastic and reconstructive surgery and neurosurgery. The following are the Sultanah Bahiyah Hospital teaching staff: Dardo Dr. Juan Camazur, Mr. Nil Amri, Ms. Junaida, Mr. Tan Chi Wei, Mr. Yusari, Mr. Galen and Mr. Jahari. Our department is equipped with 3 wards, Ward 3C at Level 3, Ward 4A, and Ward 4B at Level 4. Our temporary daycare OT is at Jutra Hospital. Emergency endoscopy service located at X-ray department. And our surgical clinic located ground floor of specialist clinic. For teaching purpose, we have a small seminar room at Ward 4B. Students can have meals at our pantry located at surgical clinic and wards. Please follow the SOP while using the pantry. And please take care of your personal belongings. This 4 weeks clinical surgery attachment is to introduce the field of surgery as your university requirements and to prepare the students' final professional examinations. This posting is also important for your housemanship training later. As you are at the stage of final year of medical education, we expect the students already have basic knowledge of surgical diseases. And the most important is the students are expected to take a good clinical history and performs good clinical examinations. If you have trouble in taking history and performing clinical examinations, please inform us, and we will guide you. For clinical subunit rotations, please divide into 4 subgroups: Group A, B, C, or D. Students will be doing rotation in Ward 4A, Ward 4B, Ward 3C and clinic on weekly basis. Students are not allowed to swap or cross over in between subgroup. This is an example of subunits rotations. For example, in week 1, Group A will be in Ward 4A, Group B will be in Ward 4B, Group C will be in Ward 3C, and Group D will be in clinic. Now, we will brief on wards. Ward 4A caters for hepatopancreatobiliary and urology. Ward 4B caters for general surgery, hepatopancreatobiliary, and urology. Ward 3C caters for colorectal diseases. Students expected to follow ward round, which will start at 7:30 a.m. In Ward 4A, bedside clinical teaching will be conducted by your university lecturers. But in Ward 4B and 3C, bedside clinical teaching will be conducted by HSB staff. During wards attachment, the students are expected to do simple basic procedures under guidance such as venipuncture, inserting cannula, wound dressing. These basic procedures are important during your housemanship training later. Students must learn about patient ownership and expected to follow the progress of the patient. Students are required to clerk patient and prepares for bedside clinical teaching, and finally doing on-call duties. As a preparation for housemanship, students are expected to do on-call duties. 2 students are expected to on-call in each ward, from 5 p.m. till 10 p.m. The on-call students must clerk all patient admitted during this period, and must present these cases the following day. For bedside clinical teaching, as per KKM guidelines, only 6 students are allowed during each bedside clinical teaching. Please contact the lecturers a day prior and discuss when is the suitable time for teaching. As Sultanah Bahiyah staff is also clinical surgeons, there will be a time we are unable to conduct teaching due to busy clinical works. If this happens, the teaching will be conducted at different time or day. For clinic rotation, students are expected to be in clinic at 8 a.m. For Sunday and Wednesday, students are expected to follow general surgery clinic. For Monday, students are expected to follow pediatric surgery clinic and Tuesday to follow colorectal clinic. There are no clinic on Thursday. But on Thursday, students are expected to go to Jutra Hospital to learn about excision of lumps and bumps. As we are in the era of COVID-19 pandemic, please do not overcrowds in closed space. As such, we suggest the university to continue online teaching. During clinic session, only one student is allowed per clinic room. Students must always practice good hand hygiene and must wear face mask with face shield. Starting this year, students are not allowed in emergency department areas. Finally, if you are unwell, please inform your faculty and please stay at home. Department of Surgery wishes you good luck, and we hope you will excel in the coming final examinations.